Good morning. It's Ian, Keith, Dad, Grandad, as usual. Looking a bit bleary-eyed and a bit, bad hair day. Yeah, I thought I'd do this one because it's been a little while since I've posted one, and a couple of things have happened. I've literally just woke up from my first night's good sleep after I've had the TURP operation. Couldn't get to sleep at hospital, or tried. I mean, I felt great, really comfortable, but nah. Right, so, yeah, this is going to jump about a bit, I guess. But basically, I went, a week ago, I went for my PSMA PET scan, which is interesting. Long day, 9.5 hours, Plymouth and back. Traffic, roads closed, yeah. I had to go through to Plymouth, to Derriford for it. It's the only place that does it that's nearest us. Yeah, interesting because got there probably an hour early to make sure we got there on time, and they didn't do it on time. And then I realised that they were waiting for the special juice, the injectable stuff, the radioactive thing. And about half an hour late arrived this guy with a trolley on wheels with radioactive signs all over it. So, excuse me, anaesthetic, got a bit of when they put the tube down, I got a bit of a sore throat and getting a bit of a cough, but anyway. Yeah, so he arrived and almost immediately then they started ushering us in. And on my letter it said second, what was it anyway? Second scan or something, and then it had 90/25. So, because they do the usual thing, name, date of birth, blah blah. And then she said, any questions? So I said, well, what's that 90/25? She said, I don't know. Nigerian woman or girl, very nice, So she went, she says, I'll go and find out. I said, no, don't bother. She said, no, I'll find out. So she went away and came back a couple of minutes. And she says, 90/25 means that you have to wait 90 minutes after the injection before we do the scan. And the scan will last for about 25 minutes. Oh, right, okay. Well, I thought it was going to be 60 minutes and then half an hour scan. So anyway. Yeah, so she explained what they were going to do, I said, yeah, fair enough. So I was laid on a couch in a very small room, only just enough room for a couch and a stool. Very comfortable, and she went away. She came back with a trolley, and on this trolley was like a long, almost like a domino box, the old box we put dominoes in. A bit bigger than that, slightly bigger, but it was a tin. And of course she'd put a cannula in me arm, and it was a weird looking thing. It had got like 3 tubes on it, which is unusual. Normally there's just one. So she came along with this thing, and first of all she's got a needle, and she connects it, and it looks like it's got clear fluid in it. And I realised it was flush. So she puts it into one of these tubes and leaves it dangling, and then she reaches over, lifts the lid of the tin and pulls out this weird looking needle. I've never seen it like it before. I guess it must have been lead lined or something, or lead covered, because it was like yellow, and it looked like almost like an old matchbox, a web matchbox, about that sort of size, sort of. And on it was the usual plunger at one end and the needle at the other, but then there was the body of it was this square looking, well, it wasn't square, well, it was square in shape, but it was like rounded sides, for comfort, I guess. Anyway, she puts that in, connects it to the cannula, and I'm not looking because I'm a bit squeamish. She injects that in, and then clearly she must follow it with this flush fluid because she doesn't want to leave the cannula radioactive with the radioactive fluid. So she flushed it with the cannula and gets it all in. And then she says, right, 90 minutes, I'll see you. Don't move. You can use the toilet, but, please stay still and don't, move around. Just lie there and, be comfortable. Which I was, and I just laid there 90 minutes. And after 90 minutes, bang on time, she came round. She says, right, come on. Oh, sorry, 5 minutes before, she popped round. She said, we're going to do the CT scan in 5 minutes. Please go to the toilet and urinate. And I think the reason for that is that the radioactive substance goes obviously through your kidneys and things and goes into your bladder, so it gathers in your bladder, so you get a big black spot where your bladder is on the image. So clearly the bladder is covering the spine at the back, and of course the prostate's around there, and the cancer likes to go to bone, so it can metastasize on the base of the spine, and they obviously want to see if there's any chance of any tumours growing on your spine. Well, of course, the bladder is in front of the spine because you laid on your back when they're doing it, and it blocks the view. So what they do is they get you to have a pee, so that the bladder is as small as possible, gives them the best chance of seeing anything behind. But of course, I could only pee a tiny amount, like an egg cup full. So I said, well, I'm only going to pee 100 millilitres at best. I said, so it's not going to make much difference. So she said, well, do what you can. So I did, came back, and more or less as I came back from the toilet, and it's a special toilet, it's got signs on it, radioactive signs, I think. Clearly it's purely for radioactive urine. And I'm assuming it must not go into the normal sewers. I'm assuming they gather it and then dispose of it as radioactive fluid. So then in for the CT scan, lay on the bed, in the tube, the usual thing, dum dum dum. Well, it's not, there's no dum 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 dum. It's pretty quiet actually, but you can hear it, so it's obviously whirring, going around. And you're on your own, and when you lay on the thing, and where your feet are on the wall, what I noticed is just before she walks out, she lifts this screen, and there's a window, and behind the window is where they sit. So she goes out, and of course it just comes on this loudspeaker, we're going to start now, don't move, and if you try lying still for half an hour, oh, it's hard, it's bloody hard. Anyway, so she does that, and she says, when she finished, she came in, first thing she do, shuts the screen down over the window, so you don't see that you're being watched. And I said, any chance I can see the scan? She says, no, it takes time to develop or whatever. And she said, we'll send it to your consultant within 10 days, because they do the analysis as well. So I'm about 10 days away at that time, from seeing the oncologist, which is, today's Friday, and I'm due to see the oncologist next Wednesday, which is the biggie, when I get to know exactly what's and where, and what we're going to have to do to sort of control it. You have a drink of water, I've got a dry mouth. Anaesthetic again, gives you dry mouth. So I was glad to get it over with. It was because, you're one step further on, so you feel happy. Yeah, 10 minutes gone by, so I'm going to keep rolling. So got home eventually. It was about 9 o'clock at night. We set off at 11 o'clock in the morning. 9 o'clock at bloody night before we got, well, 8:30 actually. 9.5 hours, as I said. There you are. 5, 6, 7. 7 o'clock. I think it's 7. No, it's 8 o'clock, sorry. I counted wrong. Getting old. So, anyway. Right, so, bank holiday weekend went. Everything okay. Oh, they tell you not to go near pregnant women or young children or young pets, because you're radioactive for 12 hours or so. It's a strange feeling because you realise that there's all this radiation whizzing around you, and I sent little sort of gifs on WhatsApp to family and friends of Incredible Hulk, because my grandson Ethan, he said, "Oh, Grandad, you're going to go green and turn into Incredible Hulk." so I sent this GIF Hulk, going, this, as Hulk always does. So I sent that round them all for a bit of a laugh. And my wife sent it back, because underneath the GIF I put, I'm beginning to feel a bit funny. the GIF of the Incredible Hulk. And she sent a message straight back saying, "That's not funny." so I had a chuckle at the fact that she wasn't finding it funny, but so she was being funny by not being funny. Yeah, anyway, you can go on forever, can't you? Yeah, so excuse me, anaesthetic. Yeah, so I was my appointment at Troisk, which is the Royal Cornwall Hospital in Truro, which is the big hospital in Cornwall. It's the only big hospital, because Derriford is in Plymouth, which is in Devon, just over the border. Yeah, so turned up Royal Cornwall Hospital. My eldest surviving boy, I should say, drove me there. It's just short of 40 mile. Thank you very much, Darren. Yeah, so got there and went to the wrong place. Went to where I had the biopsy, and I said, "Is this where the operations are, surgery?" She said, "Oh no, love, you want to be one floor up." So I went one floor up, and sure enough. So they sat me down and put me in the waiting room. And so my appointment was for 11:15, and so I got there about 10:30. And we were literally sat there for, when I say we, I'll go in a minute. Hi, Graham. So, yeah, got through it all. Oh, you're doing well. Anyway, I'll explain. Yeah, so sat in the waiting room, so I'm the first in, it's empty. I thought, oh, I'm early, there's only me. I'll soon get through this, and I expected about 11 o'clock them coming and saying, can you come through and start going through all the, what's your name, date of birth, putting the tags on your wrist, putting the cannula in your arm, But literally, we sat there for, as I say, probably about 4 hours. I don't know what went wrong. I don't know why. And we were speculating. I said, well, it's probably that they ain't got any beds empty, waiting for people to empty the beds, because the hospital, when I walked into the hospital, there was 8 ambulances outside, obviously with patients in them. It's not immune, and Cornwall, holiday times, gets a lot of visitors, and it puts a burden on the hospital, and it's bad enough in the winter time. In midsummer, it's going to be terrible. Anyway, politics. Yeah, so sat there and eventually got talking to these guys, and there was Stephen at the end. Firstly, this guy walks in, he's got like a trolley behind him. I thought, he's in for op. And the lady comes around about 11:30 and shouts my name. yeah, I might as well mention it. Said, Spencer, and both me and this guy said, yeah. so she looked a bit confused because she doesn't normally get two people answering. So she says, I've got Spencer. So, yeah, we're both called Spencer. So, which is incredible. So then we start chit-chatting, oh, yeah, your name's Spencer. And he starts saying he's in for a hernia op, third one in 6 weeks, something still sore from the first, So you get life stories. So anyway, then this older guy walks in and sits at the far end. I found out his name's Stephen. I think it was Stephen. Yeah, Stephen. And then this young lad walks in and sits by me. And so we start conversation, and it turns out Stephen was in, what was it now? Oh yeah, it sounded like he got cancer on his kidney. Or the tube to the bladder from his kidney has got cancer on it. So it sounds a bit naughty, a bit nasty. Sorry, Stephen, if you're watching this, because I gave you all the details. I'm not trying to scare you. I'm just concerned for you, really. Nice guy. But he got called into one of the interview rooms and came out and basically said, I've got to go home. It's no good them doing what they were going to do, putting the camera into his bladder. He says, I've got to have an operation. So, I don't know, let me know, Stephen, if you're watching this, and if you did follow it through, I don't know whether you did, but if you do, yeah, let me know, I'd like to know. But Graham, interesting young lad, I think he said he was mid-30s. When I say young lad, it's when you get 70, I'm double his age. So, yeah, so I'll not give you all his details, but effectively he was suffering some urinary problems. But I started sort of telling him about this video channel I'm doing now, and he was interested, so I got into all the little stories and things, we're having a bit of a laugh and a joke, just to pass time, And I might have been a bit sort of heavy-handed because, I'm I still can't think of word, Graham. Not a convert. I'm still not obsessed. Well, anyway, but you know what I'm trying to say. I still strongly believe in what I'm doing, trying to help others and get the message out there. And I'm doing it in my own little way, and it helps me doing this. But anyway, yeah, so, and he showed me this photograph of, what was it, yellow bunting or something. Oh, beautiful photograph. And he proceeds to tell me that he's into sort of wildlife photography. Oh, and it was spectacular. Well done, Graham. Beautiful. I'm tearing up. Stupid. Good photograph. It's because of the beauty of life that's getting to me. When I was talking to him, I teared up a couple of times, on some of the things that you've already seen on here, if you're watching the things. But, beautiful. Yeah. Been a silly bugger. But spectacular photograph. Oh, wish I'd got that ability. Yeah, anyway. Oh dear. bit of a funny story coming. Well, not funny really, but so I forget how it all bloody went now. So eventually they came and said, they interviewed me and did all the pre-ops in these rooms where we sat, and I saw. Well, it was Nadeem. It was an Indian guy. And he was like the surgeon, so he was going through what they were going to do. And I knew what they were going to do. And so I asked a few technical questions around how they were going to do it. I said, how much do they actually remove from the inside of the prostate? Do they just clear a tube out, like core an apple? And he said, oh, no. He says, we leave 2 millimetres around the outside. We take everything out the inside. So I said, it's like an orange then. I says, you go in, I says, and you remove all the pith, leaving the, not the pith, the juicy bit in the middle. You leave the skin and the bit, the white bit around the inside of the orange. So yeah, he says, more or less, that's what we do. He says, we leave that 2 millimetre margin around the outside. He says, so that we're not getting too close to the edge of the shell, so to speak. And then I said, well, where's the sphincter that controls the urine flow? And I didn't know, but it's at the bottom of the actual prostate. I thought it was the bottom of the bladder. There you go. Learned something from him, Nadeem. Well done, Nadeem. So I saw him a few times during the day too. And I'm saying this so that you learned as well as me. Yeah, so he then explained that they go in and cut all this out, save all the sort of cuttings and then have it all analysed. So that was that. And then the anaesthetist came, and I'm still sat in the same waiting room, and the anaesthetist sort of came in and went through everything, making sure I was fit and healthy and, blah, blah, all my lungs and things. So I went through all that and signed the consent form, And I didn't click on at the time. I think his name was Ben. And I'll mention it later, but, I didn't realise. And when I looked at him, I thought, I recognise this guy when he first walked in. But never thought anymore. Anyway, went and... where did we go then? That's right. They took us round into like a changing room, like 4 compartments. And she said, put all your clothes on, take all your clothes off, put this gown on, and we'll... and then she took us back into a waiting area. And I sat there in the same waiting area with Graham, because he'd already gone through this, he'd got the gown on. And then she came, called my name, eventually, and literally walked me out. And I was carrying me sort of hold-all bag, but I'd got this sort of, she says, put your slippers and dressing gown on, which I did. So she literally walked me down, and they've got like a security lockers, and she put a tag on my bag, put my bag in this locker, and she says that will be safe until, you come out of the op. And then she wandered me down, and obviously would take me into the theatre area. I never do like normally. You go to your bed, and then they take you from your bed. Not this time. So then there's like a big reception desk with a woman sat behind, and I end up having a right old chit chat with this woman. I don't know what to think. So anyway, they sat me down these seats, and the woman that was already sat there, they just came and took her as I arrived. So I was sat there probably about 15 minutes, and she's got the thing up on the screen. She says, they won't be long now. She says, they're getting ready for you. I said, can you see on your monitor? She says, yeah, we can see when they've gone into the recovery area. She says, so I know that they'll be preparing the theatre for you. So I said, that's marvellous. Tech bomb technology. Anyway, we had a conversation, as you can tell. So I saw Nadeem walk by with his blue hat on. So then this lady comes and sits by the side of me, name, date of birth, usual, all the crap, making sure they haven't got the wrong person. And have you got any allergies? No. So she then says, right, follow me. Walks down this fairly, like 50 metre corridor, well, 25 metre maybe. And then there's like the flat doors, with the little windows in that you always see. She takes me in there. She says, this is the anaesthetist room. And so there's this guy again, the anaesthetist that I'd had the interview with. And then it clicked. I says, your face, I says, it's familiar. I says, you look like somebody. I said, I'm trying to work out where I've seen you. And it was, I forgot now. Oh dear. And I couldn't think at the time. I did eventually. I says, have you watched the film strange beasts and where they come from. It was her that wrote the Harry Potter thing. She did this other book, and they did film. Oh, nearly got it. Anyway, Andrew something or other, the main actor who plays the part with all these little creatures. Really good film. I enjoyed it. Andrew Savage, Savant. Oh, anyway, he's won awards. He's a very well-known actor, and he looks spitting image of him. This Ben. Anyway, they lay me on the trolley, and I says, "This way you're going to do it?" He says, "Oh no." He says, "We wheel you through them doors there. There's another set of double doors. When you're out cold," she says, "we take you there." So they do they use name, date, and they check all the tags on. I've got on my ankle, one on my ankle, one on my wrist. And he says, "I'm going to give you a what do they call it? Something to calm you down." He says, "You'll feel a bit drunk." And sure enough, he put this thing in. I could feel it. He says, "You'll feel it a little bit." And it's sort of rooms that, the pictures on the ceiling were going ooh, a little bit. So I didn't mind it really one bit. But then he puts the oxygen mask on, and what they do is because they've got to put the thing in your throat, and you can hear my voice. I'm a bit croaky because I've got a sore throat. So they get you, move your head back if you've got false teeth, all this sort of thing. Open your mouth wide, and they're making sure they can get the thing in okay without breaking your neck, I guess. So he does all this, and he puts the oxygen mask over because they get your blood oxygen up to 100 to give them time to get this thing. Because what happens is that when they inject you, they inject you really hard, a lot of fluid. And Graham did ask what the fluid was called. I do not. I'll try and think and mention it. Sorry, Graham. I should have done that bit of homework before I did this, but sorry. Yeah. Anyway, so he says we're going to start. So while I'm breathing, he says take 5 really deep breaths. I'm, getting the oxygen in, and the room starts even worse. So he then says, we're going to start introducing the sedative now. I'm trying to think I'm using the right words, but anyway. So he starts, and the nurse is rubbing my arm, very, very, she's being very gentle, as they're obviously injecting very slowly the sedative in. And next thing I know, I'm waking up. So literally, I drifted off, can't remember a thing. What he did tell me, he says, we normally wake you back up in the theatre. He says, but I don't think you remember that. He says, because it's the drug, it affects your memory. And I don't remember it. He says, but you'll come round, first thing you'll know, you'll come round properly in the recovery area. So I wake up in this recovery area, and of course I've felt this before, coming round, it's a nice feeling. Operation's done. I did ask at one stage, how long will I be on the table? And he says 60 to 80 minutes. Could be 90 minutes, he says, but that's about normal. So anyway, I'm laid there on my bed that I'm going to be sleeping on for the next day or two. And the nurse is there, and, just chit-chatting. Nothing really important, everything's gone okay. And at the bottom of my bed, there's like a wooden screen, and clearly there's somebody behind it. I later found out it's Graham. Didn't know, because they always keep you there for a certain amount of time, making sure that you've recovered all right. And I'm 29 minutes now, so I'll have to get a bit quicker. Anyway, so they wheeled me out, and as they're wheeling me out, I said, "Oh, hi, Graham." And I gave him a wave, So I said, "Oh, hello." And because there's all these nurses and doctors around him, he then proceeds to say, "He's famous, he is, So they all looked at me, sort of thing, as if to say, "Do we recognise you?" So one of the nurses says, "How is he famous?" "He's got a YouTube channel." And it's really good. he starts bloody wanting them to subscribe. As I remember, Graham, I might be overflowering it a bit, but I do apologise. But of course, then this nurse who's wheeling me gives me a right eyeball and said, So I then had to say to her as she's wheeling me along, I do this YouTube channel about my life with my prostate, because I've got prostate cancer. So anyway, eventually they get me back in the ward. There's these other guys there who eventually get to know. And it was Adrian and Jeremy. That's it. And they both got diabetes, and they've both not managed themselves very well. As a consequence, they're losing blood flow to the toes and feet, and potentially they're in for amputations up to the knee. So, not very, I felt it for them. But nice guys, chatted all afternoon and all night long, getting life stories and little funny bits, And I could do a whole video just on that, but I'll not do it. One was a lorry driver, other one was a fitter working on a farm, and then, life story going out about doing fitting work around the area, around Cornwall. But yeah, so the upshot is that I then laid in bed, and of course I've got a catheter to drain my bladder all the time, and they're flushing it, so they've got 2 big 3-litre bags hung up on the rod, and these are emptying in about just over an hour maybe, and they have to come and empty the bag at the side of my bed into these cardboard bowls, 2 of them, and carry them out and empty them somewhere. And of course they're checking the colour to make blood clots and things, because I'm bleeding heavily inside. So they're flushing it to make sure I don't get a build-up of blood and a big blood clot. Otherwise I'd have to have surgery, I guess, to get it out. So literally all night long they're doing this, bags are going up, and, God knows how much to flush through me. But eventually I could see on the tube it went from red to pink, and then to rosé, and then it went to clear. So I could tell it was stopping bleeding. So I felt great, and I don't know, and I was trying to work out why am I feeling so good, and I thought, is it the anaesthetic wearing off? And I thought, no, I'm not feeling the after effects of that really, other than usual. But what it was that I realised that they'd cut out this tumour and they'd taken it away. And I know it's out of my body. I've got cancer cells everywhere. But it was the mental knowledge that I got rid of it, that they cut it out. And it was so, relief, but stupid. No benefits from it really at all. Anyway, so I sent a message around various family and friends, which, you're watching this, you'll remember getting it. 3 o'clock in bloody morning I did this message, so I got no else better to do. I got a lovely view out the hospital window. And so, I watched the night go by. Yeah, so then came round, and this is going to be a long one, I think. I apologise. Then came round at about 5 o'clock, the nurse, because you've got a dedicated nurse looking after you. And she says, I'll come round at 6 o'clock. She says, if everything's okay, I'll take your catheter out, urine catheter. And she says, what you do then? She says, you have to do 3 P's in the hospital bed bottles, urine bottles. And she says, depending on how you do, we'll then let you home. Oh, bloody hell. I thought I was in another day. Because I'm no sleep, I'm knackered a bit. But anyway, so duly enough, 6 o'clock, she comes round and she says, well, I can't do it. She says, I've got to get the nurse, qualified nurse. So she comes and looks at my bag and says, no, it's a tiny bit pink, we'll give it another half hour. So it got to about 7 o'clock, I guess. And she comes round, she gives the nod, so, out comes the catheter. And I've no doubt a lot of you in there watching this go, oh, because I went, oh. I said to my wife afterwards, I says, it was like they were trying to turn my penis inside out to pull this thing out. Because it's a fairly big one, and it's got a balloon on the end that keeps it in. And the nurse, while she's doing this, because I'm saying, I'm asking her what's it going to be like now. She says, believe it or not, she says, we have some patients who get, they're go a bit delirious or whatever. She says, they pull it out. She's with a balloon inflated. Oh dear. Oh. That makes your legs cringe. Anyway, so she pulls it out. Oh, thank God. So she says, fill your bladder right up as best you can before you pee in the bottles. So I did that, and I started getting the urge. I've got to go to my 2 sort of roommates. So off I toddles, takes the bottle, pees in it. I said, oh look, and then it's all blood when it came out. But obviously they pulled the tube out and done a bit of damage. So she felt the weight of it. She's not enough. She's got to do at least 100 millilitres. Oh, shit. So she went away. She came back. She says, you've done 60. So that's about normal what I was doing before. So she let your bladder fill right up before you pee. So anyway, she then gave me another bottle. So, oh, shit, so I've got to do another 3. And she writes on them 1, 2, 3. So, so probably like Irish right, left and right on the wellies, so you don't lose count. So anyway, number 1, I do that. She comes back, she's 98. But I'll accept it, 100. Oh, thank God. So because you're drinking loads of water. Next one, 100, bang on. Oh, great, And I'm starting to notice that when I look in the bottle, it's dark, but you can see it's more like urine rather than blood, red. And she says, so that was, 100, second one. Third one was 140. Oh, bloody hell, I've not peed 140 millilitres in bloody years. So I knew straight away, I was getting benefit from my op. So I gave her this, and she came back. She says, 140, well done. She says, but just to be certain, we want an extra one. So okay. So number 4. So she then does number 4. And I can't remember what it was. She didn't tell me, I don't think. Because she came back, she says, we're not really happy. She says, the consultant isn't happy. She says, because you might be having fluid retention, which will damage your kidneys. She says, so we need to do a scan to see what's left in your bladder. Make sure you're draining it. When she checked my bladder, I got 190 left in my bloody bladder. So, but while she was doing the scan, I says, I'm beginning to feel like I want another pee already. She's because we're concerned that your kidney isn't producing enough to get rid of it, that you've got some kidney damage. So anyway, she did a scan. She's do another bottle, which I did. She didn't tell me how much. So she says, I'll do another scan. So they did another bloody scan. She says, the first time was 210, that was it. Second time was 190. She said, while she's doing the second scan, I says, you're pressing with the ultrasound. She says, I can feel like I want to pee now. And that was only like 5 minutes after the last one. So, so she came back. She says, I'm going to phone the consultant, get his go ahead. So she did, and sure enough, okay, you can go. So that was about 2 o'clock, 1 o'clock, 1:30, something like that. Yeah, so, of course, now when I pee, it stings and burns, which they said I'd get. But then, whoosh, it's coming. And I think I sent a message around or whatever, and I says, I nearly peed up the toilet back because it literally, it was that much. It's pounding into the toilet now, and I haven't done that in years. So I could write my name 6 foot away in snow. So it's brilliant. Yeah, so I've had a decent night's kip, but the trouble is when I start to want to go, it hurts, and I desperately get to the toilet. So because it's healing, they've said it's going to take a couple of weeks, but I'm due this coming Wednesday. I've said at the oncologist, the first interview, and it's 40 minutes now, so I'm talking quick. Yeah, so I thought I'd do this one now because I didn't want to do 3 lots of events in one. I've done 2, and it's been a while, probably about 10 days or so since my last one. Yeah, so I thought it was time, and, hello to family, all my brothers and sisters, and Graham, because he's subscribed. I watched him do it, and, thank you very much. It's very pleasing, and keep up that photography work. Excellent. You've got a talent, sir. And let me know how you've gone on, and if Stephen's watching, yeah, let me know. Band of brothers. Oh, and you might notice I shaved. Well, I didn't shave. I sort of trimmed my beard off down as low as possible, because I know when they put the oxygen mask on, they have to get a seal round here, and I've had the problem before when I've had a good beard. You lose oxygen around the sides, and so they put it on really tight. It hurts over here. So I trimmed my beard off to help them, so it's now just growing back, 3 days growth or whatever. So anyway, yeah, right, that's it. That's me signing off. A lot happier. Obviously one hurdle over. I'm now peeing better. Big hurdles to come next Wednesday. And I get a treatment plan, and then I'm going to be HRT and all the rest. Talking about HRT, makes you realise how some people choose to be ignorant at their own detriment. I was talking to this one of the guys across the way in the bed. He doesn't just tell me he's got diabetes, he tells me he's got prostate cancer. So, bloody hell. I says, how are they treating you then? How long ago? It's about 4 or 5 years ago I got it. So I says, how are they treating you? He says, they give me an injection every 3 months. And now it's every 6 months. So I said, that'll be HRT then, is it? Don't know. So I said, are they checking your bloods for PSA every year or 6 months or whatever? Don't know. Not really bothered. What? You're ignoring the things that affect your life, and oh dear. And then I thought, I know why I do these bloody videos. Know your PSA, know what they're doing, make sure they're doing it right for you. Because I'm shaking. Because I'm going to be bloody doing it. I'm going to be making sure they're doing everything bloody damn right. And I'm presenting myself for my PSA tests every 6 months or whatever they ask for. I'm making sure I know bloody results. And I'm going to be plotting it on my bloody computer and doing a graph. Making sure it's staying down, Anyway, coming up 45. Apologies. So it's Ian, Keith, Dad, Grandad, all the usual. Signing off for now. Peeing a lot better. Feeling a bit happier. Yeah. See you on the next one after Wednesday. Bye for now.